no pressure. We're just
No, right?
channel it. Who would have thought a microphone would be such a challenge? Everybody ready? Good afternoon. I'm Yellowstone County Commissioner Dennis Pittman, and we are excited to be hosting today's press conference. As your county commissioner and small business owner, I understand the health and economic struggles this virus has created. COVID-19 has hit our community hard over the past year. Our way of life has been changed dramatically, and like everyone, we are ready to return to some type of normalcy. We know the next step is getting our community vaccinated. Vaccination supplies have been uncertain, but it appears we have a turning point and are ready to open a community vaccine site. The Yellowstone County Commissioners, in partnership with United Health Command and the team at Metro Park, will be using a facility called Cedar Hall on the Metro Park campus as our first community vaccination site. Our Metro Park team and the Unified Health Command have been preparing Cedar Hall for this week to begin the process of vaccinating our most vulnerable populations at this community site. This is such an important step in fighting the virus, and we encourage all Yellowstone County residents who want the vaccine to use this site when it is your turn based on the governor's phasing. I'm going to turn this over to John Felton, our public health officer, for more details on the vaccination clinic.
Thank you, Commissioner Pittman, and thank you all for coming in today. I'm excited to continue working with our Yellowstone County Unified Health Command partners to vaccinate all community members who desire to receive the COVID-19 vaccine as soon as possible. We've been working towards centralized vaccination clinics that are free of charge and provide central registration for appointments. This is still a work in progress, but we want to update you today on what's coming next. As Commissioner Pittman said, we'll hold our county's first centralized vaccination clinic in Cedar Hall on the Metro Park Fairgrounds next week. We plan to offer appointments Tuesday from 1 p.m. till 4:30 p.m., Wednesday and Thursday from 8 a.m. to 11:30 a.m., and then again from 1 to 4:30 p.m. As with all vaccinations for COVID-19, advance appointments are required. The vaccinations that will be provided at Cedar Hall are first doses. Everyone who's received a first dose of the COVID-19 vaccine at either Riverstone Health, Billings Clinic, or St. Vincent Healthcare will return to get their second dose at the same site. Generally, our local providers have been scheduling those second dose appointments when the person receives their first dose. And this will be our policy at the Cedar Hall Centralized Clinic as well. People will receive their first vaccination dose and schedule their second dose before leaving the building. Appointments for vaccinations at the Cedar Hall site will be available online via a link beginning at 1 p.m. tomorrow, Friday. That link will be posted at covid.riverstonehealth.org and sent out in a news release as soon as possible on Friday. You can also make appointments by calling 406-651-6596, and that phone line will open at 9 a.m. on Monday. Again, 406-651-6596, and phone appointments will become available Monday at 9 a.m. We're well aware that the demand for these vaccinations far exceed the vaccine supply that we have at this time. We appreciate everyone's patience and cooperation, and we remain determined to vaccinate all Yellowstone County residents who want the vaccine as soon as possible. I would now like to invite our Unified Health Command hospital partners to share some important information with you. We'll first hear from Dr. Mike Bush of St. Vincent Healthcare, and then Dr. Tony Green-Sheetwood from Billings Clinic. Thank you.
I have to make sure I have these things on here. So, I am Mike Bush. I'm the Chief Medical Officer at St. Vincent Healthcare. And this is really an important and monumental day in a lot of ways. This is the next step forward in the work that we're doing to distribute the vaccine to our community. We started a few weeks ago giving vaccinations at St. Vincent's through the process that we set up. To date, we've given almost 10,000 doses, but particularly, even today, but particularly those first few clinics that we had, the level of joy, excitement, and the relief that the people coming through were feeling was palpable, and it was inspiring to all of us. As we have moved forward, though, we knew that we would be limited, and as the vaccine supply and the other providers of vaccine came online, to meet the needs of the community, we were going to have to start providing community vaccinations and providing them together in a way that was scalable, that we could really expand the capacity. And so we're excited to be participating next week with our United Health Command partners to be starting as we learn how to do this in a bigger and broader setting. And going forward, that's a thing that we would really like to emphasize, that we know that the current capacity isn't going to meet the need. But as we go forward, we're hoping that the supply and so on will come out in such a way that we can continue to meet the need of the community in a much greater way. We will continue to do this without charge, as John said, and we're pretty excited to get there. The other thing I would like to say is just to reinforce that the safety and efficacy of this vaccine is without question at this point. Even if you look at the data around the new variants that we're seeing, you knew that was going to develop. But these vaccines that have been released are 100% effective at preventing serious illness and death, even with these variants that we're hearing about in the news coming forward. And so, again, I'd like to express my excitement that we're able to participate starting next week with United Health Command working out at Cedar Hall. And I will turn this over to Dr. Green-Sheetwood. So thank you very much.
Hi, thanks for having me today. I'd like to echo Dr. Bush and the safety and efficacy of the vaccine and how excited we are to participate with United Health Command at Cedar next week. At Billings Clinic, we've administered almost 12,000 vaccines. That's first and second doses, with 4,000 first doses since we've opened up to 1B a few weeks ago. Billings Clinic will continue with first dose vaccinations for the next 2 weeks to wind down the commitments we've made to our local partners with our call center as well as staff. Following that, in March 1st, we will be transitioning fully to the United Health Command Cedar Hall vaccination process. As Mr. Felton indicated, we'll be continuing our second dose vaccines to complete those vaccine series for those that have started so far. Again, we are really excited to participate with our community, continue to bring this service as fast as we can to everyone interested in being vaccinated against this devastating disease. Mr. Felton?
Thank you. I think you've heard how excited we all are to be moving on to this next step and look forward to more vaccine supply and being able to grow this even further. So at this point, we'd open up to questions, and please indicate who you'd like your question directed to.
I have a question for Tony.
Yes, ma'am.
Hi.
Hi.
I'm Mari with the Billings Gazette. I just had a question about Billings Clinic's involvement in the UHC site.
Yes.
You were saying to commit fully to the Cedar Hall site as of March 1st. Can you explain what that means specifically? Will you still have vaccines at Billings Clinic for right now, or?
Absolutely, thank you for the question. So we will be having staff starting with the United Health Command next week.
Okay.
But because we've committed to staff as well as our local business call center that we've been using, we want to wind down those commitments over the next 2 weeks before we can shut down all of our first doses, because we've made those contracts and those commitments to those individuals. But we're starting to staff next week alongside Riverstone Health and St. Vincent's.
Okay.
But starting in March 1st, we will no longer do first doses. Those commitments will be completed.
Okay. I know Felton, John was talking a little bit earlier this week about Billings Clinic's involvement in it, and I wasn't sure if you guys were planning to involve since the beginning, or if you wanted to sort of do your own thing for a while, but I was just curious.
Sure, I think the important note is trying to vaccinate as many people as possible. So the idea of having 2 sites wasn't, well, we've had 3 sites, frankly, for
Yeah.
the last several weeks. So winding down from 3 sites to 2 sites to 1 site was part of the conversation.
Okay.
But we've been participating in Health Command since the inception of the community vaccine and working towards getting ourselves wound down. But
Okay.
initially we were planning on completing our first doses because of those commitments.
Okay. The other thing I wanted to ask was just the administration fee and that sort of thing. This Cedar Hall site will be free of charge, but obviously if Billings Clinic continues to do vaccinations, will that change at all in terms of fees or anything like that?
The administrative fee for the next 2 weeks, we haven't planned on changing that for those 2 weeks.
Okay.
But if we were as second sites or third sites or fourth sites, depending on hopefully allocation that permits that, participating with the county and the United Health Command is something we would definitely do.
Okay. Thank you.
Sure.
Mr. Felton? I know I often ask you to guess or estimate, but do you have an estimate when we might go through 1B and start 1C?
You know, we don't have an estimate. That the number that we believe is probably that 1B category in Yellowstone County is somewhere around 45,000 to 50,000 people. So we do have a ways to go. It was announced just out in the state that we do anticipate a slightly larger allocation of vaccines to the state next week. And over time, we expect that those allocations will increase. So what we fully expect is that we will grow the Cedar Hall site as large as it can accommodate, and then move to another centralized site, so we'll have multiple sites available. That's the commitment of the Unified Health Command, is to get that vaccine out as quickly as we can by working together to staff sites and get the vaccine administered.
And do you expect that we'll have a centralized site for all of 2021?
I think most people believe that it's going to take at least through the summer to get up to a level of vaccination that we start getting some population protection. How long that goes is going to depend on how rapidly we get vaccine into town, as well as the receptivity of people to get vaccinated. So as long as you have people to be vaccinated, we will be giving it to them.
Thank you.
Mr. Felton, I have something that's not directly related to the vaccines. So tomorrow, Governor Gianforte is expected to repeal the mask mandate. Soon after he took office, you rescinded all orders in Yellowstone County and said you're going to match our directives with his. There are a number of other counties around the state that are going to continue to enforce the mask mandate. And I do know that Yellowstone County numbers are dropping in terms of new cases. But is there any, thought process as to whether or why we're essentially going against CDC guidelines? CDC is saying we should be double masking, and we're going to rescind this mandate.
So the CDC tells us as people we should wear our masks, and we fully support that, and we've said that over and over. What we don't have is a mandate, and Yellowstone County has never had a mandate. We followed the state. When we look at where we are, we haven't seen numbers at this level. You have to go back to July and August to be where we are in terms of new cases, test positivity, and hospitalization rates. I think the governor has said it best. It's too early to stop taking preventive measures. and I've said to you all many times, you've heard me say this, I really, in my heart of hearts, do not believe that any of us should feel that the only reason that we wear masks, keep our distance, sanitize surfaces, stay home when we're sick, wash our hands, is not because the governor or I as the health officer tell you to do it. We should do it because we care enough about the people around us, our families, our friends, our coworkers, our businesses, our schools, to take the measures necessary to keep our community safe. I think we have the full capability of putting on our mask and keeping our distance, regardless of whether we're told to do that or not. And I have confidence in our community that we will continue to do that.
I have a question for you. So, to my understanding, it sounds like the allotments that the hospitals get and Riverstone gets will be pooled together for the Cedar Hall site. Is that right?
Yeah, I think we need to be really clear about one thing, and all of us as provider organizations understand this. The doses that have come to our community were never Riverstone Health doses,
Okay.
Billings Clinic doses, or St. Vincent Healthcare doses.
Okay.
They're Yellowstone County doses.
Right.
They went to those provider groups because we're the first ones to be administering the vaccine. There are a number of other provider groups throughout our community, medical practices, pharmacies, and that sort of thing, that are also on the list to receive vaccine. What's always been expected is that the vaccine that comes to Yellowstone County, regardless of what entity it gets stored at, are for the county.
Right.
So what we're really doing is, as we get more vaccine, consolidating our resources, consolidating the doses. And I will speak specifically for Riverstone Health. We also have a lot of things that are still going on, and we need our spaces.
Mm-hmm.
We're using essentially our entire first floor now is being used for vaccination. So that was never a long-term sustainable model. But when we had such small doses and we're basically administering them all in a matter of a few hours, it didn't make a lot of sense to put all the effort in and work that takes to create a centralized site. We're there now. We have enough. And again, at no time was it ever a requirement that to get doses at Riverstone Health that you be a Riverstone Health patient. And the same is true about hospitals, they're community doses. So
Right.
I think that is a fallacy and a misunderstanding that we need to work really hard to correct. It's
Okay.
always been about serving our community.
Okay. And I'm also curious, these vaccines that you guys are getting this next week, or maybe have been getting already, are these from the 20,000 that were reallocated from long-term care?
Some of them were.
Okay.
So we got, basically the state uses a distribution algorithm, and whatever doses they get, they run through that algorithm. So when some of the doses that were initially intended for long-term care facilities but weren't required, became available, they were simply put into that distribution allocation.
Okay. Thank you.
Mr. Felton, when people come to this clinic at Cedar, what can they expect? Are they going to sign in, get a vaccine? Is there a period of observation after they get the vaccine? How will that process work?
Yeah, so fortunately, we have 3 organizations that have practice at this. We all know how to, we've learned how to manage the flow. This is a great opportunity for us to take the lessons learned in 3 different environments and put them together and do it better than any of us could alone. But essentially, we're going to ask people have to have an appointment. We're going to ask them not to come more than 5 minutes before that appointment because there's not waiting space. They'll come in, they'll register, they'll get their vaccine, then they'll go to a monitoring station for 15 to 30 minutes. And while they're at the monitoring station, they will be able to schedule, or they will schedule their follow-up second dose.
And, sorry, one more. Do you know, is the number of slots or appointments available for each of those days, is that going to fluctuate from week to week, or is that going to be standardized?
Until such time as we have a standard shipment of vaccine, it's going to fluctuate from week to week. And I know that's a real frustration for our community. It would be great if we could say, for the next 4 weeks, we know what's coming, and that's simply not the case. We find out, the state finds out on a weekly basis what it's getting, so we also find out locally on a weekly basis what we're getting. We're all hopeful that over time that supply will not only increase, but will stabilize, so that we can schedule people out several weeks rather than having to go a week at a time. I know that's really frustrating for people, but I think it would be more frustrating if we guessed wrong and we had to call people up and say that your appointment wasn't available after all. Any other questions for anybody?
I had another question for you. This isn't vaccine related, but just with the, the governor rescinding the mask mandate tomorrow and all these other things, I was just curious about how that could affect the education liaison team for the county.
Yeah, so I've actually had some conversation with the state. The state will continue to accept complaints.
Okay.
And distribute those. That's a little bit of a challenge, quite frankly, because once the restrictions are gone, there's nothing to violate. But we will use those staff if people need some education and help. It's still going to be important. And again, I think this is a point worth making. The rescission of the mandates does not mean that we're out of the woods, that we no longer need to mask, we no longer need to keep our distance, we no longer need to worry about sanitation. All those things are still really important. We are a long ways from having enough people vaccinated or immune through getting illness to think that our community is safer. So if people want education, we'll happily come out and help them do that. And then also we will, those staff have been redeployed. They've already done some help with us on some vaccine work and some other things.
Okay. Thank you.
Any other questions? Thank you all for coming.